Next, we have Dr. Chen, who will present robotic versus laparoscopic gastrectomy for gastric cancer, comparison of short-term surgical outcomes.
Morning, everyone. The topic I will speak today is robotic versus laparoscopic gastrectomy for gastric cancer. Hold on. Please. Okay. Nothing to disclose. The gastric cancer is a major public health issue in the whole world. The recent studies show that laparoscopic gastrectomy for gastric cancer has a better minimally results for both early and advanced gastric cancer. Besides, for benefits for the patients, robotic gastric cancer gastrectomy might provide a more precise incision and more surgical skill. Last year, we performed a meta-analysis comparing robotic with laparoscopic gastrectomy, and the result is that robotic gastrectomy is an acceptable method for gastric cancer. But up to now, there are few studies focused on the indication, overall survival, and the recurrence-free survival of gastric cancer. This is the data of our hospital, the gastrectomy for gastric cancer from 1996 to 2013. And about 1,145 cases underwent laparoscopic gastrectomy and 122 cases underwent the robotic gastrectomy. From these cases, 93 robotic and 330 laparoscopic gastrectomy was chosen for this study. These are inclusion and exclusion criteria. The D2 lymph node dissected was used by laparoscopic and robotic gastrectomy. There are no significant difference for two groups in the clinical characteristics. That is the results. The surgical results of robotic and laparoscopic gastrectomy in the operative time is longer, bladder loss is less, and the lymph node dissected is more in robotic gastrectomy. And there are no significant difference for the other surgical parameters. And the short-term outcomes, there are no significant difference for the first factors, eating, complications, and etc. But the robotic costs more money. The survival curves show us there are no significant difference in recurrence-free survival and overall survival for two groups. And in subgroup analysis, the operative time is longer in total gastrectomy, proximal and distal gastrectomy for robotic gastrectomy. But the bladder loss is less in robotic gastrectomy in the distal gastrectomy. In the early stage gastrectomy, gastric cancer, the bladder loss is less and lymph node dissected is more in robotic, but in advanced gastric cancer, they are similar. The overall survival in early stage and advanced stage, there are no significant difference. So from this study, we find that robotic gastrectomy has advantages of less intraoperative bladder loss, more lymph node dissected, but longer operative time and costs more. Thanks for the 3D vision and the more precise dissection, the robotic results more these advantages. But the robotic requires setting and docking, resulting operative time longer. So we conclude that with less blood loss, small lymph node dissected, robotic gastrectomy is a promising approach for the treatment of gastric cancer. However, with limited training and less experience, the indication of patients for robotic gastrectomy is critical. Thank you.
All right, any questions from the floor? So if I just want to make sure I understand it. You did see an advantage with distal gastrectomy. Was that the major area where you saw the advantage with, as far as the robotic group goes?
Mm-hmm. You mean just small cases in the robotic,
Yes.
but most for laparoscopic.
Okay.
Because in China, a lot of the cases with the gastric cancer are in the later advanced stage. So most of them we used by the open surgery, and some for the laparoscopic. Just a few cases were chosen for the robotic gastrectomy.
Okay. And what percentage now of the gastrectomies are done open at your hospital at this point?
You mean in our center? Maybe just 1/3 to 1/4.
Okay.
Yeah.
Or done open?
Yes.
With the open
yes,
technique?
just a small for lapar, and most for open. Yes.
Okay.
Yeah.
And then what percentage are done with the robot at this point?
The small number, maybe just one.
Less than 10%?
Yeah. Yes,
okay.
less than that. Yeah. Yes.
Okay, very good. Yes, sir.
Yeah, Human Fong, California. Very nice talk. I very much enjoyed it. In California, to do a robotic gastrectomy or robotic liver resection, we spend $2,700 more. In Beijing, how much more do you spend to do it robotically? And who pays for it? In many parts of the world, the patient pays out of pocket for that difference, and therefore it is neutral to the hospital. In Beijing, what do you do?
About $20,000 maybe in Beijing, one cases.
Yeah.
Maybe the most the part maybe pay the patients and some for the governor. Yeah, yes.
All right, very good. Thank you very much, Dr.
Thank you.
Chen.